Tonight, we continue to remember legendary NASCAR driver Kyle Busch. We told you last week that he died from severe pneumonia that had turned into sepsis. Channel 9's Jonathan Lowe talked to a Novant Health doctor who wants us all to know the warning signs.
Both of the top-tier Cup Series championships Kyle Busch won over the course of his career happened while he was here at Joe Gibbs Racing in Huntersville. He left the team in 2022, but they are still honoring his memory. There is now this memorial blocking off the number 18 parking spot, which corresponds to the number 18 car he drove over the course of the 15 years he spent with the team. Mere seconds after winning Sunday's Coca-Cola 600, Trackhouse Motorsports driver Daniel Suarez was overcome with emotion.
Race is official. Daniel Suarez wins the Coca-Cola 600. What a tribute to Kyle Busch.
It was a moment of celebration combined with sadness over the sudden loss of someone Suarez says was a mentor early in his career.
It's been a very tough week. Kyle, he was a special man.
As NASCAR paused pre-race to honor Kyle Busch, fans were moved by heart-wrenching moments, like when his grieving family was brought out on the track.
Our thoughts and prayers are with his wife and kids, his entire family.
Or on lap 8, when fans in the stands held up the number 8, paying homage to the car Busch last drove.
It was beautiful. I think they did a very good job of honoring him.
But as the racing world continues to mourn his death, concern and awareness around the severe pneumonia turned sepsis that took his life is just as prevalent.
Sepsis is a medical emergency. Pneumonia can get worse rapidly.
While Dr. Daniel Feinstein, a critical care specialist with Novant Health, is not involved in Kyle Busch's case, Feinstein is co-director for sepsis care at the hospital.
When we have mental status changes, when we have confusion, when we have distress of our breathing or increase in our respiratory rate.
He says the elderly, very young children, and those with compromised immune systems are most at risk of pneumonia. But he explains how someone much younger with a stronger immune system could develop a life-threatening case.
They compensate by breathing faster. They compensate maybe for the heart rate going up, and those patients can have dramatic rapid declines.
But Dr. Feinstein says while Kyle Busch's untimely death is a horrific wake-up call,
I really don't want our public thinking that, oh my gosh, I have pneumonia and I'm 100% going to be getting sepsis, because that's clearly not the case.
He says as long as a person is vigilant about the symptoms and seeks medical care, pneumonia can be treated at home sometimes with antibiotics.
When we can get to you quickly, we can help patients quite a bit, but time matters.
Dr. Feinstein says Novant Health has a standard, rapid approach to the identification and treatment of sepsis. He says their data shows they're finding an average of 30 patients a month who were predicted not to survive, but that actually do and are able to go home. In Huntersville, Jonathan Lowe, Channel 9 Eyewitness News.
Now, the doctor also told us that there are significant spikes in the number of pneumonia cases, especially starting in the fall, going into winter, and also in early spring. You can find all of our coverage honoring NASCAR legend Kyle Busch on our website, including tributes from fellow drivers, fans, and learn more about his history behind the wheel. Look for the top story on our homepage.